Dr. Pavan Chappi. I'm a consultant orthopedic surgeon here at Apollo Spectra Hospital, Koramangala, Bangalore. This particular press meet is for discussing about a challenging and complicated case of one Mr. Sanjay Singh. He had a fracture of the hip joint way back in 2019. This was operated somewhere else in North India. After multiple failed surgeries for that, which had started off in 2019, he developed a limp and shortening of his right hip joint. So this particular issue was particularly a challenge for a further surgery because of presence of an implant already in the hip joint, the bone loss because of a implant which is eroding the bone around, and also the increased limb length discrepancies, that is increased shortening of the length of the limb. So with all these challenges in mind, we had to design a custom made individualized hip so that we try to finish the surgery in one stage, which is ensuring or helping the patient to get mobile immediately after the first stage or the single stage of surgery. So keeping this in mind, we used this particular implant which was helped by Merrill. So this is just the same copy which he has got inside. So we got this prepared and we did the surgery, which took about 4.5 hours, that is to remove the implant, clear the bone and put the fresh implant and do all this without any complications. We finished the surgery successfully on 24th of December, 21st of December last year, and it's been roughly about 2 months today and he's doing perfectly fine. Honestly, I had a lot of doubts when I started off with this, but I was confident that it will be successful because we did our homework well. Our team had done our homework well, and also post-operative physiotherapy, which is an essential part. And Mr. Sanjay Singh did cooperate with us to do all the physiotherapy activities properly without any hiccups. And here we are, standing continuously with us, standing straight, Mr. Sanjay Singh.
So which is a smaller version of the Apollo because we follow the same rule. So this particular Spectra is only focused on surgery because you go to a larger hospital, even if I say Apollo Banargata Road, you go there, you go for a general surgery, you have to wait, you don't know when you will get the OT. True. But here we keep it open. We have 4 OTs very well equipped. We've done good head and neck surgeries, and sir has done so many replacement surgeries, complex surgeries, and you name it, it has been done. So we focus on surgeries because patients don't want to stay for long in hospitals. So that's why we call it a short stay surgery. If it is a replacement surgery, of course 5-6 days you need to stay. But there are surgeries where people come in the morning, get operated, by evening they go. We talk about varicose veins, vascular surgeries. They will go the same day itself. Even some orthopedic surgeries also, I think knee replacement, shoulder surgeries, they go the same day or the next day morning.
The cost also comes down a little.
Cost, yes, of course, it will come down. So the other factor is that, I don't want to harp on cost, but yes, we are more cost effective because our billing is, it's a package kind of a billing. So people know we are very transparent.
How many beds you have?
So here we have altogether around 22 beds, including post-op. Most of the rooms are single rooms. We don't have double sharing because we want to give that privacy to patients. So we do it, and as I said, patients don't want to stay in hospital. The sooner they want to go post the treatment, they want to go. So that's what we do at Spectra.